Hello and welcome to Visual Pathology Lab. I'm Dr. Nasish. We are doing a series of short videos on cellular adaptations. Cellular adaptations, as you all know, are classified into atrophy, hypertrophy, hyperplasia, and metaplasia. For the videos on metaplasia and atrophy, the link will be given below. Now, we're proceeding to discuss hypertrophy. What is hypertrophy? It is nothing but the increase in the cell size, which eventually leads to the increase in the organ size. What is a normal physiological hypertrophy? Can there be a physiological hypertrophy? Now, is hypertrophy always pathological? These are a few questions that comes to our mind, right? In the normal routine life and practice, you must have observed that certain people who go for weight training, they go for strength training, weightlifting, they build up their muscle to their desired size. And this is called hypertrophy. There's nothing pathological about it. And this is one of the examples of physiological hypertrophy. So, what happens in the muscle fibers? Actually, the size of the individual skeletal muscle fiber increases, and that's why the muscle appears bigger. Why there's only hypertrophy and not hyperplasia? Hyperplasia is increasing the number of the cell. Now please remember the point that the cell types which are non-dividing or cell division limitation in those particular cell types, only hypertrophy will occur. Hyperplasia occurs in the scenario where the cells are rapidly multiplying. For example, skin cells. So, for example, glandular tissue cells. They can undergo hyperplasia. But in cell like skeletal muscle fiber or maybe smooth muscle fiber, there's usually hypertrophy. This is the normal physiological type of hypertrophy that you see. Let me give another example. There are certain diseases in which the muscular walls they undergo hypertrophy. For example, this is the ventricular wall of human heart, and it has undergone hypertrophic. If you can appreciate the thickness of this muscle in the ventricular wall, appreciate that it is far, far, far bigger and thicker than its counterpart, which is the normal counterpart. So you can see that this is the thickness is far more as compared to the normal ventricular wall, and this is called hypertrophy, and it occurs most of the time hypertension. And people with long duration hypertension, there is overload on the heart, and it undergoes compensatory ventricular hypertrophy. Another example of hypertrophy. This is another image where you can see a hard specimen, and it is a gross specimen of the heart, where you can appreciate the comparison between this is one ventricle wall, but there are different segments. One is normal, is of normal thickness, but the other one is quite often 3 or 4 times more thicker than the normal ventricular wall. What happens? Are there any situations where there is hypertrophy, which could be mixed with hyperplasia? We will discuss those conditions also. But for now, the smaller one is the normal uterus, and the bigger one is the gravid uterus. The gravid uterus is a pregnant uterus. So in uterus, even there is increase in the size of the uterus because of the increase in the thickness of the wall, and this happens under the non-physiological conditions of pregnancy. Now, talking about hyperplasia, what is the difference between hypertrophy and hyperplasia? As I just explained in the beginning, that the hyperplasia is multiplication or increase in the number of the cells of that particular organ or tissue, and obviously this will give a bigger size to that organ. Now, this is a specimen of a prostate gland, and the prostate gland, we know that it is under the influence of different hormones, especially testosterone. In the older age groups, benign prostatic hyperplasia is a disease which occurs in people with more than 50 years or 60 years of age, and they have this enlarged prostate. But Can you appreciate the nodularity of this specimen? This is enlarged. This whole as a prostate is enlarged. But can you appreciate the nodularity of this surface? And this nodularity is the reason why we call this disease benign nodular hyperplasia. Now, when you see this under the microscope, prostatic histology in the normal prostatic tissue is like this. There are glands, these purple lining cells with lumen, whitish lumen. These are the glands, and this lighter shade of purple or pinkish is the stroma, right? This is the normal histology of a prostatic gland. It is a fibromuscular organ. So there is fibrous tissue, the muscular tissue, which makes up the stroma, and then the glands are interspersed between them. But when you compare this normal histology with histology of the benign prostatic hyperplasia, you will see that there is increase in the number of glands. These are all glands with white lumen. These are the purple lining of the cells, and you can see these secretions within the glands. These are the secretions, and this whitish area is nothing but the lumen. You see this gland, this is one gland, this is another gland, and then comes this is maybe another gland, right? Where is the stroma? The stroma lies in between. So you see only a strip of a stroma in between so many glands. This means the number of glands have increased, right? And it has compressed the stroma. This is a case of hyperplasia, and since it is in prostate, we call it benign prostatic hyperplasia. I'll give another example of another organ which is a female organ, and it is known as uterus. We'll come across many of the cases in the perimenopausal or postmenopausal age groups where there is endometrial hyperplasia. This is the uterus which is cut open from the center, and in the center you see this is endometrium, which is by all these standards is more thickened than the normal uterine wall. So why is it so much thickened? Because of the influence of the estrogen hormone, and because of this hormone, this endometrial hyperplasia has occurred. It appears grossly like that, but when you see it under the microscope, the normal endometrium appears something like that, and this normal endometrium is nothing but it is made up of glands. These are the glands lined by single layer of epithelium and a lumen inside. So 1, 2, 3, 4, 5, 6, 7. These are all glands, and this is interspersed stroma. This is normal histology. But when you go for endometrial hyperplasia, you will see that there is an increase in the number of glands, and these glands are very closely located and separated by only a very thin strip of a stroma. You can see it here also, a very thin strip of a stroma, and this is dangerous. This is called endometrial hyperplasia. This may turn into a dysplastic lesion and can lead to endometrial cancer. These are some of the visual examples of hyperplasia and hypertrophy. I hope this will give you a very good orientation of how hyperplasia and hypertrophy looks like. Happy learning. I'll see you in the next video.